What are you supposed to do when you are post-surgery or even freshly injured? Typically, you should see a physical therapist, but do you know why rehab is so beneficial for your health? Do you know why it's so important to attend your sessions? Rehab will save your life. Hi, my name is Sarah Medikevich, and today's workshop will be about rehab adherence. Have you ever gone through rehab yourself? If so, did you have a positive or negative experience? Well, with today's workshop, I will be discussing what rehab adherence is, why it's so important, and what the effects of rehab adherence are. So for my audience, it's mostly for patients who have been injured, had surgery, and need more information on rehab. And it's also useful for therapists, athletic trainers, or even sports psychologists. So now you might be wondering, what is rehab adherence? Well, the idea of rehab started thousands of years ago when the Chinese had a movement to relieve pain from people suffering. As time went on, Greek and Roman physicians created rehabilitation programs to help wounded soldiers and to promote gymnastics. According to a study by Levon et al., in 1921, Franklin Roosevelt opened a rehabilitation center to those who suffered from polio, like he did, and it was to regain strength and independence again. His facility offered different therapy services such as swimming, OT, heliotherapy, and more. So, rehabilitation refers to a medical specialty focused on prevention, diagnosis, nurturing, and therapy for patients who experience certain limitations to their body resulting from injury, disease, or malformation. Adherence is the commitment or devotion to something. Therefore, rehab adherence is the commitment to going to therapy to gain as much function or to get back to good health as possible. So, rehab can take place in a variety of places, such as a hospital, a home, a gym, a clinic, etc. It just depends on what is most accessible and convenient for patients. Adherence attendance is likely to decrease for the patients who find it difficult to make it to their appointments on time, find the location of the facility to be inconvenient, and have difficulties finding parking. So, question, what is the definition of rehab adherence? So for my second main idea, why is rehab adherence so important? Rehab adherence is important because patients should want to be committed to recovering and gaining functionality back into whatever was injured, repaired, or diagnosed. That way, they can resume to their everyday life and pick up where they left off previously, if possible. It's important to go through with the regimen given. Therapists are there to help motivate and support their patients as much as possible so they feel comfortable and willing to adhere to their rehab. If a therapist doesn't portray those kind of qualities, would you want to go to them? It all depends on what kind of therapy the patient is comfortable with. One study found that patients who did at-home therapy reacted positively to rehab adherence. Programs that were made for at-home can reduce the intensity of pain in the patient, perceived impairment, and enrich functional capacity, according to a study by Bachman et al. Although at-home therapy may not be for everyone, a clinical setting could be a better fit for a patient because it forces them to get up and go to their session. As I said earlier, there may be some limitations going to a clinic, but it really is whatever the patient prefers and whatever will get them to adhere to their therapy. So another important factor of rehab adherence is the therapist giving specific instruction or guidelines as to what the patient should be doing or needs to be doing. They would be more likely to drop out of their program if the therapist isn't giving them a thorough explanation of their rehab plan, according to a study by Fisher et al. Therapist's job is getting their patient to recover as quickly as possible. Patients don't want to be in therapy forever. They want to see results as soon as possible, and that is another reasoning for adherence. So, can you name one reason why rehab adherence is so important? So, for my third main idea, what are the effects of rehab adherence? And this part is very important. The effects of rehab adherence solely depends on their commitment to the rehab program. If the patient genuinely enjoyed rehab, attended it on a regular basis, and got to fully recover because they devoted a significant amount of time to their therapy, then they should be positive. The results should be good for the patient. And so, as I mentioned previously, the therapists play a major role in the recovery of the patient. If a patient has a good relationship with their therapist, then they are able to put their trust in them. So in order for the therapist and patient to form an alliance, they must come to an agreement on goals, interventions, and the effective bond between the two, according to a study by Ferrer et al. So when these standards are met, I believe the patient will have a full recovery. So after going through rehab, patients will most likely be back to their maximal functioning. This will allow them to return to their everyday lives and regain the strength and agility needed. Rehab is a healing process that is meant to preserve the patient's life. So going to therapy will give the utmost optimal results. So for another question, why do therapists play a major role in recovery of the patient? So how can you apply what I just taught you? So for those of you who are therapists, athletic trainers, or even sports psychologists, apply these topics onto your patients or even friends or family who are going through rehab and need motivation or support. You can also teach others about rehab adherence and why it's so important to stick with it. So do you know another way like you can apply these topics to your everyday life, or do these topics even pertain to you? So in conclusion, there are many factors that play a part in rehab adherence. The main points are rehab adherence is the commitment to going to therapy in order to get back to good health. Rehab adherence is important because it's important for the patients to be able to function as much as they can after being put through therapy, no matter what their situation was. Once they're at maximal functioning and don't need to go to therapy anymore, they have officially recovered. So you can use all these concepts on your patients of your own who are having difficulty finding motivation to adhere. You can also teach others these concepts and the importance behind rehab adherence. So last question for you. Overall, what did you learn from this workshop? And what will you do with this information when you leave? And these are my sources.